Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I wanted to talk to you today about the importance of the mineral zinc in human health, including its role in optimizing immune function, because it's very much underappreciated by the average person as well as by many health professionals. So, some people take zinc lozenges if they feel a sore throat coming on or the initial signs of a cold. And some evidence suggests that this may be beneficial, but ensuring adequate zinc intake on a daily basis for the prevention of health problems, including respiratory tract infections, is the strategy we should be paying more attention to according to nutrition and immunity studies. So without getting into too many details, it's well established that optimal zinc intake is required for optimal function of our immune system, as it works to protect us against respiratory tract and other infections. So it's interesting to note that North American population studies show that at least 55% of adults do not ingest the amount of zinc per day that's recommended by government agencies. And in many underdeveloped countries where daily nutrition is poor, or the grains that they're consuming are very high in phytic acid, which blocks zinc absorption, it leads to severe zinc deficiency. And zinc deficiency is a leading cause of death in these countries. According to the World Health Organization, zinc deficiency is currently the 5th leading cause of mortality and morbidity in developing countries, affecting 1/3 of the world's population. So worldwide, zinc deficiency accounts for approximately 16% of lower respiratory tract infections, which are really the dangerous ones, 18% of all cases of malaria, and 10% of these diseases where diarrhea is constant and ongoing that can be life-threatening. And zinc supplementation can correct that. While severe zinc deficiency is rare in developed countries, mild to moderate zinc deficiency is actually quite common even in our society. So unlike the mineral iron, the body has no way of storing zinc to any appreciable degree, and thus optimal daily intake is required to maintain optimal tissue and circulating levels. So you need to be getting zinc each day to replenish what you lost the day before. In North America and in many developed countries, 30% of elderly individuals are shown to have mild to moderate zinc deficiency. In other groups where marginal zinc deficiency is common would include Black Americans, Mexican Americans, and premenopausal women of childbearing age, and especially those between women who are 12 to 19 years of age. So it's recommended that adult males and non-pregnant females who are adults, because pregnant women need more zinc, but for the rest of us who are adults, both men and women, we need 15 milligrams of zinc a day. Studies show that adult males and females in North America average only about 11 milligrams of zinc a day from food, and elderly subjects over the age of 71 are averaging only 8 milligrams a day. So this sort of chronic, ongoing, suboptimal intake of zinc on a daily basis over time can lead to signs and symptoms of mild to moderate zinc deficiency, which is not uncommon in our society. So signs and symptoms of this sort of marginal zinc deficiency state include decreased immune function or compromised immunity, because so many aspects of the immune system require zinc for optimal functioning, so you're more prone to infections and other problems. Also, decreased ability to taste food, decreased taste acuity, as they call it. Decreased dark adaptation. If you turn out the lights and it goes dark, your eyes don't adapt to the darkness nearly as well if you have a zinc deficiency. Decreased lean mass. Zinc is required for certain hormones to be synthesized that help to maintain your muscle and lean mass. And also for wound healing, you need zinc, both skin and also bruises. So think about what happens as people age. They complain of not being able to taste their food to the same degree as when they were younger, and they often lose their appetite as a result of that. They lose their muscle and lean mass and their strength. They become more prone to infections, and if they get an infection, it's often more severe. And if they have any skin wounds or bruises, they often heal very slowly, or they don't heal at all. So these signs and symptoms, which are often attributed to just the normal aging process, are often just indicators of an underlying zinc deficiency that can be corrected through proper nutrition and/or supplementation. By the way, treating those skin wounds that often don't heal very well with topical zinc ointment has been shown to solve the problem in many cases. But the real underlying problem in the first place was that the person had an internal zinc deficiency from poor nutritional status. So, however, I must caution you that taking high doses of zinc supplements can be dangerous, leading to impaired immunity, a copper deficiency leading to anemia and other serious problems. So the idea here is that you don't run out and start taking high-dose zinc supplements, because that can actually make things much worse. Just let me find my place here as I scroll down my teleprompter. So there we go. So don't take high doses of zinc unless your doctor advises you to do it. So what seems to be a reasonable solution to ensure adequate zinc intake each day, along with other nutrients that are lacking in the diet from day to day, is to consider taking a simple multiple and vitamin mineral supplement. Now I say this because the 2017 National Health and Nutrition Examination Survey report showed that 31% of U.S. adults are at risk for at least one vitamin deficiency or anemia, and those vitamin deficiencies often include vitamin A, vitamin B6, folic acid, and B12. But the same studies also show there's a high prevalence of suboptimal intake of the minerals calcium, magnesium, and zinc, and in elderly people, particularly zinc and selenium, are lacking. So adequate zinc nutritional status is something to pay attention to each day to keep your immune system firing on all cylinders. So consuming a well-balanced diet is the starting place. Now beyond that, you may want to consider the merits of a multiple vitamin and mineral each day, or just taking it 5 days a week, as a safeguard measure to ensure adequate zinc intake along with other vitamins and minerals of importance. Now, as a final note, blood tests to ensure adequate zinc nutritional status in children and adults is reflected by a zinc blood plasma level at 100 micrograms per deciliter, or within 10 micrograms of that. So anything between 90 and 110 micrograms per deciliter is considered to be adequate zinc nutritional status. Values below 80 suggest a mild to moderate zinc deficiency, or a marginal zinc deficiency. Once you're down at 50 micrograms per deciliter of zinc in your plasma, you're in severe zinc deficiency. Now, unfortunately, blood plasma zinc tests are not routinely done by your doctor during an annual physical exam, and provincial and state health plans don't pay for zinc blood tests. So if you want a zinc blood test, you'd have to request it from your doctor and be willing to pay for it out of pocket. But truthfully, in most cases, it's unnecessary to go to these lengths. If you eat properly and you consider using a standard multiple vitamin and mineral supplement each day on a regular basis, even 5 days a week, in my view, you've really got it covered. So zinc nutritional status is something that is sort of looming there in the background. Most people, or many people, have sort of a marginal suboptimal intake of zinc that can lead to compromised immunity, decreased dark adaptation, loss of muscle strength, these poor wound healing. If you notice any of these symptoms, it might be that you might have a marginal zinc deficiency. You might want to improve your diet and or take a multiple vitamin and mineral each day, but make sure you check with your doctor first to make sure that would be advisable. So I've included the references for this information in the text below. Thanks for watching, and I will see you next time.